I am with a very special guest today. I have Dr. Divya Sahetya. She's an OB-GYNAC and she's a fertility specialist. Today, Dr. Divya is going to be throwing light on a very important topic. It's the topic of miscarriages. A lot of women are actually not comfortable talking about miscarriages. They have a lot of misinformation about this topic, and it's also considered a taboo to discuss these kinds of things, which is why today we decided to take this topic and we wanted insights from Dr. Divya on this. So firstly, Dr. Divya, thank you so much for being a part of this and welcome to the show.
Thanks a lot for inviting me.
Great. So, Dr. Divya, the first thing I want to ask you about miscarriages is that, what is the cause generally of a miscarriage? And, do hormonal issues in women like PCOD, thyroid, some kind of an hormonal imbalance, does all this also play a role in maybe inducing a miscarriage over a period of time?
Okay, let's discuss basically what's a miscarriage or a pregnancy loss. Basically, it's the loss of a pregnancy earlier than 20 weeks of gestation. Usually, it happens spontaneously. So, there are different types of pregnancy losses. Either it could be a threatened pregnancy loss, or it could be an inevitable, means she's having so much bleeding or pain and she's definitely going to lose the pregnancy. Or it can be an incomplete loss wherein she's already lost the pregnancy, but there could be some products remaining inside her uterus. Then there is a type of loss wherein, the pregnancy just does not grow further. So that would be either a blighted ovum or a missed abortion, wherein it has grown up to a point and then the baby loses its viability. So, of course, as far as the cause is concerned for a pregnancy loss, there are a lot of causes, as well as in a lot of cases, it's unexplained. And a lot of women may not even be aware that before they are getting a first period, they would lose a pregnancy. This happens most of the time. So, effectively, just about 10 to 20% of the women who lose their pregnancy are actually aware of it. And most of the pregnancy losses usually happen earlier than 12 weeks. That is the first 3 months of pregnancy, there is a higher rate of miscarriages or pregnancy losses. So, discussing the causes, in a lot of cases, it could be unexplained. And a lot of these women, I can say 80-85% of women who have had a first miscarriage can conceive again naturally and carry a baby to term and deliver a life healthy baby. It's very rarely, maybe in 1 to 2% cases, wherein they may have recurrent pregnancy losses. There is definitely a role of hormonal imbalances contributing, especially, if it's a PCOS with very high levels of insulin resistance, it or very high levels of LH or male hormone levels, they could be at a risk of pregnancy losses because PCOS is known to also affect the egg quality. So if the egg quality is affected, it's definitely going to affect the embryo quality. As far as thyroid issues are concerned, uncontrolled hypo or hyperthyroidism also is known to result in pregnancy losses, or it can affect the course of pregnancy. Even, if the prolactin levels are very, very high, there can be ovulation dysfunction and there is a slightly higher risk, or at least it can contribute to a pregnancy loss. So even if hormonal disturbances are not directly related to a pregnancy loss, but they can definitely contribute to early miscarriages especially.
Okay. Okay. Thank you, Dr. Divya, for the detailed information on that. I think a lot of girls will now be aware about this particular phenomenon, as per what miscarriages are and what are the different kinds also. So thank you for that information. Doctor, you mentioned that the first 3 months are very crucial. Also, is there a particular time phase, in the trimesters that the woman goes through, any specific time period apart from the first 3 months where she has to be a little bit more careful and, maybe a little bit more precautious about few things as to avoid a miscarriage then?
So, of course, as I mentioned earlier, the first 3 months, especially the early weeks of pregnancy, less than 8 weeks or 2 months, are very, very crucial. But after 12, 13 weeks, the chances of a pregnancy loss really reduce. So majority of losses usually happen in the first 3 months because nature that way is very benevolent. Nature usually allows only a normal healthy pregnancy to continue further. Later on, there could be some maternal factors which could contribute to, even if not a loss of the pregnancy, but it could, affect the growth of the baby, or it can affect the further course of the pregnancy. So I feel every trimester has its own important, we cannot say one trimester is more important than the other, but it has been found, if the mother has certain medical issues like diabetes or very uncontrolled blood pressure, so it can affect the course of pregnancy throughout. It can affect the growth of the baby, and often there have been just sudden demises of the baby inside the womb, before the mother can deliver. So a lot of medical factors, if not controlled, can contribute to a loss of a pregnancy even later in the pregnancy. Similarly, if there are certain autoimmune factors wherein, there's an increased propensity of clotting in the blood vessels, so it can affect the placenta, and thereby it can result in a sudden pregnancy loss. So you have lupus, you have, certain thrombophilias, which again increase the chances of a pregnancy loss. So it's very important that the pregnant female follows her obstetrician's advice very strictly. Whatever investigations, sonographies, blood tests are advised, monitoring the baby movements, one pays proper heed to it and just does not neglect it.
Yes, thank you, doctor, for that advice. On the account of losing the child, or having recurrent miscarriages, are there any treatment options available for women who have recurring miscarriages?
Yes, there of course are treatment options. Of course, the percentage of women having recurrent miscarriages is lesser, but every pregnancy loss just sucks the female and the family, not just physically, but also mentally and emotionally. So, I would like to give a special mention to a thorough psychological evaluation in such women and couples, and to pay a lot of heed to the emotional and mental well being. First, it's very important that those with recurrent miscarriages, they are counseled very well before we treat them for another pregnancy, because of course they are really not prepared for one more pregnancy loss. So as far as the investigations and the workup is concerned, of course, we have to find out what is the cause of the recurrent pregnancy loss. So there could be a lot of causes. Out of them, the most common causes are, of course, the maternal age, especially when she's above 35, 37 years of age. There is an increased risk of chromosomal genetic issues which can contribute to pregnancy loss.
Yes.
Then, as well as, if the baby, the fetus in a recurrent pregnancy loss, if you have investigated further, they've done the genetic testing. So if the genetic material shows some sort of issue, genetic or chromosomal issue,
Yes.
this could be one of the factors. Then there could be some structural defects in the uterus. There could be fibroids, or there could be some polyps. So it could be a congenital issue wherein, there could be a septum, or it's a double uterus with a single cervix. So, we have to rule out a lot of factors, or there could be some clotting issues, there could be some sperm defects, lifestyle issues contributing, obesity, lot of factors. So it's very important first to evaluate and identify, and then accordingly manage it accordingly to prevent a pregnancy loss. In a lot of cases, of course, we cannot find a cause.
Yes. Yes.
So often it has been seen that wherein, in spite of a detailed workup, we cannot find the cause for the pregnancy loss. A lot of these women with just regular care also can conceive and carry a normal pregnancy to term. But it's very important first to identify what's the cause and then accordingly treat it.
Absolutely. Thank you, Dr. Divya, for that, insight. I also feel that, one of the main biggest things that you just spoke about right now is that women who go through recurrent miscarriages are supposed to be counseled. Their mental health is of prior, and it's something that people need to keep prior, and also something that for them should be a priority. So thank you for, highlighting that fact for everybody. Also, Doctor, on the changes that are happening. So after a woman loses a child, when there has been a miscarriage that has happened, what are some of the common hormonal and physiological changes that the woman goes through? If you could highlight those for us, please.
Oh, so of course, if she's had a pregnancy loss, it's going to take some time for her to recover physically as well as emotionally. As far as the emotional aspects are concerned, one really cannot predict, but there could be a lot of grief, anxiety, insomnia. So it's very important to identify that. So she needs a good family support as well as she may need professional help. As far as the physical aspects are concerned, usually she's going to get her period in 4 to 6 weeks post the miscarriage. Her hormone levels, which are there, may take around at least 4 to 5 weeks to go back to pre pregnancy levels. So that's why. We also have to counsel them that maybe, she may not get her periods on time, especially if she's had irregular cycles in the past. So, calling these women for a proper follow up after 1 month post miscarriage, whether she's got her periods or not, is very important. We have to prepare them that she may have some mood swings, breast tenderness, of course. So there could be a lot of factors which definitely, would recover in a 1 to 1.5 month. So besides this, if we are talking about her planning the next pregnancy,
Yes.
so as far as planning her next pregnancy is concerned, I think it totally depends upon one is at what weeks or months of pregnancy did she miscarry. That's of primary importance, as well as how emotionally, physically, and mentally prepared she is for the next pregnancy. So we need to give them adequate time to recover, as
Absolutely.
well as if she's had recurrent losses, at least two or more pregnancy losses, then we need to give her some time. One is to investigate and find out what could be the cause. So that's going to take another good amount of time till we identify what could be the cause of the pregnancy loss.
Absolutely. Thank you, doctor, for pointing out those, very essential points that you mentioned right now. On the same note, I come to the last question for today. So when a woman has a history of, maybe one or two miscarriages, or it could be more also, does that make her an ideal candidate for fertility treatments, maybe like IVF or, egg freezing or whatever else that is currently in, which is available in our current technological department as far as helping women out is concerned? So does that really put her in a place where now she can opt for these kinds of treatments?
So IVF or ART, assisted reproductive techniques, they are not indicated for every female with recurrent miscarriages. Particularly if there is a known chromosomal or genetic issue involving either of the parents, or if there is a history that whenever she's miscarried, the genetic material of the fetus showed some issue, that is when I would recommend IVF with PGTA, that is pre-implantation genetic testing, because that's the only way that we can, before she conceives, check whether the embryo is a normal embryo or it's an abnormal embryo. So this is one of the primary indications where I would recommend IVF, or of course, if she does not want to waste too much time in conceiving naturally, that could be one of the factors. So we also have to individualize her treatment protocol based on what she wants. Or, if she is a female with a depleted ovarian reserve, she's more than 36, 37 years of age, or there is a definite sperm factor, then yes, I would want to resort to IVF ICSI, but otherwise not for every case.
All right. Thank you, Dr. Divya, for that, that plethora of information on a very important topic like miscarriages. I think, today with all the information that we are sharing, all thanks to your expert advice, a lot of girls who usually would kind of hesitate to, reach out for help, reach out for support, and also, talk about these things when if it happens to them or anybody close to them. I hope that these conversations become more easier and they can reach out to experts like you for help with, helping them with coping with their miscarriages or probably trying for another pregnancy. So Dr. Divya, thank you once again for being a part of this initiative and having a conversation and giving us so much knowledge today.
It's a pleasure. Thank you.